Once the operation is complete, the patient will wake up from anesthesia in the operating room, and then the patient will be taken to the recovery room. The family is then notified of the outcomes of the operation. The patient is greeted in the recovery area by a nurse, and the nurse will continue to monitor the patient as they wake up from anesthesia and will continue to check the circulation to the legs to make sure that there is still good blood flow to both of the feet. After the patient leaves the recovery room, they will be admitted to the hospital overnight for 24 hours. They're monitored for things such as bleeding, fever, upset stomach, nausea, vomiting, and the majority of patients go home the next day. When a patient is at home, they're encouraged not to do any heavy lifting for the first week. They still have some incisions that are healing in the groin, and then they will have a follow-up in the clinic to check their groin incisions. After they are seen in the clinic to make sure their groin does not have any infection, they will also have either an ultrasound or a CT scan to make sure that their aneurysm has been repaired and that the stent graft is in a good position. Once the procedure is done, the patient will continue to follow up in the vascular surgery office for the rest of their life. We continue to monitor the graft to make sure the graft stays in a good position and make sure that the patient doesn't develop an aneurysm above or below where the graft is placed. So once the patient has had the aneurysm repaired and we make sure that there is no complications in the groin and we make sure that the graft is in a good place, patients can return to their normal activity. Usually within a week, they will go back to their normal activity. Of course, we say if they're taking any pain medicine, they can't drive, but frequently patients don't even need pain medicine. They can take something over the counter for the groin discomfort. We realize that having an aneurysm is very scary for a patient. Most patients identify with aneurysm and know of it as death. They're afraid it's going to rupture. This is something that we deal with on a routine basis. So we encourage patients to come, be evaluated, because we want to help patients to have it fixed before it becomes a problem. So our doors are open, whether it's a straightforward aneurysm, or if it's something complex, or even if it's just family member has an aneurysm and you want to be screened and evaluated for it. Our doors are open to help patients in whatever way they would need.